Are we actually going after, with all of our efforts, this idea that healing is supposed to be geared toward making people whole? Can a patient be cured but not healed? Can a patient be healed but not cured? Is it possible for a team to correctly diagnose the cause of disease, apply treatments for disease, relieve symptoms and function, but not actually heal that patient? These are really stunning questions when you give it more deep thought. And I would like to propose to you that healing is actually slightly different than curing. So, what is healing anyway? If curing is not the same thing as healing, why do our healthcare systems focus so much time, money, effort, resources on curing people? So, what on earth happened to healing in healthcare? Why is that not our focus? Well, to begin with, what is healing? How would we define what differentiates healing? I've come across multiple definitions of healing, and ultimately, I think there's one that I feel really attached to. But listen to these. Healing is a process by which a person no longer feels the effects, limitations, or suffering related to disease and loss in their life. Is that healing? Healing is a repair of damage and restoration of function. And healing is to make whole again. That's the one I'm most attached to. It's really simple, but it's extremely comprehensive when you think about it, to make whole again. I really actually came to understand this in a poignant way when I encountered a patient I was seeing for routine post-operative care. I think it was probably 3 months after her surgery of a hysterectomy that had gone well. And I was just expecting a quick and easy visit and kind of release from surgical care. And when I went into her room to speak with her, she was actually quite emotional and teary. And I was trying to, lean in to understand what was going on. And she was trying to communicate gratitude. And she said to me, "Dr. Kang, I'm whole again. I'm so grateful. You made me whole again." And I was confused as a surgeon because I actually removed a body part in her surgery. And that was hard for me to comprehend why she felt like that made her whole again. And so I asked her, what do you really mean? What is whole about you and what is wholeness to you? And she began to describe how she had seen multiple doctors before she came to see me, explaining to them her symptoms, her pain, how her symptoms of bleeding and pain were really disrupting her life and reducing her function and restricting her. And she had gone through multiple evaluations and labs and imaging and had gotten the sense from the doctors who saw her that they didn't really believe her. They didn't really think there was anything that wrong with her. And that sense of lack of validation really crumbled her spirit. And when she came to see me, she said, "You did for me what they didn't do. You listened to me. You believed me. And you saw what they failed to see, how this was affecting my life. And you heard and you asked the questions about the details. Like, how is this affecting my relationship with my husband? Well, actually, it's terrible. I have so much pain. We have no intimacy. And that's created havoc in our emotional relationship and our connection. And we fight and we're thinking about a divorce. And my kids are having mental instability and anxiety because of our relationship. And all of this is because I'm in so much pain. And no one's believing me." And she said, "When you did the surgery, you removed an organ that was causing me pain. My pain resolved, but everything else has come back together too. And it's because you listened. It's because you validated that I was having pain. And because of this, my relationship has become whole. My husband now doesn't believe that I've lost interest in him. And that's why we weren't intimate. He now realizes that it was really, truly the pain. And we have been able to resume our relationship. We're fixing and mending the fences. Our kids' sense of stability in the home has returned. You made me whole again. And that really brings to a highlight that healing is so much more than just the actual physical acts of what we're doing. It's more than the knife that I apply and the medication that I prescribe. It's also that emotional connection. So, do our healthcare systems themselves emphasize this enough? Are we actually going after, with all of our efforts, this idea that healing is supposed to be geared toward making people whole? We're maybe satisfied a bit too readily with "they're better," or, this problem has been cured, this discrete thing that I am a specialist in. But what does it look like? How could we define somebody's wholeness? I think this is tricky. Like, is it you have progressed enough? I've deleted some issues from your problem list, and your problem list on my notes is shrinking. So that's you becoming whole. Is it that I don't need to keep prescribing medications for you, and so now I can just see you annually? Is it your labs have normalized? There's a number that defines you as being whole? Because if you're not careful, it looks like that's what we think. Our patients don't think that. Is it possible to actually cure somebody and not heal them? I think it is. And I unfortunately have encountered this puzzling dilemma in some of the birth stories I've heard mothers tell me. And some women will actually, as we're kind of working through their prenatal care, begin to share with me their hopes, their fears, their anxieties about upcoming birth. And inevitably, out of that or feeding into that will be their stories of their prior births. And some women will actually describe to me this idea that they had a really traumatic birth experience previously. And I have a framework for what I think a traumatic birth is. It's very biomedical, right? Um, Something where there is extreme danger to life and limb, and maybe there is a bad outcome. Like, to me, that's a traumatic birth story. You lost your baby, or your baby was really harmed. And I don't always find that inside of women's stories of traumatic birth. Instead, what I sometimes hear is a story of danger that actually was resolved by the physician or the midwife taking care of them, and there was a good outcome. And it's puzzling to me in my biomedical mindset. A woman who had a C-section urgently because her placenta prematurely disconnected from her uterus, and she began hemorrhaging in the middle of labor. And the physician on call recognized what was happening quickly, intervened, took her to the operating room, and did a C-section to remove her baby and her placenta, saved her life, gave her a blood transfusion, saved her baby's life. Good outcome. And she's traumatized. And And you have to wonder why. And almost all the time, there's a kind of theme that runs through it. And it usually has to do with words that are spoken or connection that did not happen. And it's come to teach me that there is a very essential part of healing that we need to be careful not to miss. And that is, our words have power, and they can produce hope or they can produce fear. And they can produce a sense of prognosis that almost dehumanizes. And it's possible to do the right thing and to do it quickly and competently, and to miss connecting with that patient and identifying their fear and comforting it. These women I've heard tell me their C-section stories. They had the right thing done for them. Their lives were saved. But they almost can't even appreciate that because they felt like they had been dehumanized. Their surgeon didn't even talk to them, didn't even look at them, and only spoke fear in the room. Like, we have to cut your baby out. Now we're going to lose your baby. And it was truth, but it was not truth that came with comfort. And so, despite the fact that there was a good outcome, that patient did not feel healed and did not feel whole. Hey, fellow doctors, I want you to know I think something really exciting is happening here in Redding, California. Physicians from all over the country are moving here to be part of the community restoration that we're envisioning. We are currently actively recruiting in the specialties of obstetrics and gynecology, neurology, and primary care, although we have many needs in other areas as well. If you feel drawn to become a part of this, I invite you to connect with us at our website, www.restorehealthcareproject.org, and click on Get Connected. We have a vision to restore hope into the healthcare of a region. There's an interesting study in 2005 that was published in the the Annals of Family Medicine, titled "The Meaning of Healing: Transcending Suffering." And the authors of this study actually interviewed in a very systematic way different physicians about their views of healing, what they've learned in interacting with patients, and how they would actually define healing. And they point out that, inadvertently, the successes of modern medicine have kind of led us here. We've had so much success in curing disease and intervening on loss and stopping it, that we now feel that we can claim legitimacy to a scientific approach to healing. And to some degree, yes, that's true. But unfortunately, our focus has shifted to believe that healing is scientific only and is about the biologic cure that we're after only. And certainly that's unparalleled success in the last century compared to the history of the world. But unfortunately, the goal has shifted slightly. And in the process, they say in this study, cure, not care, has become the primary purpose of medicine. In these interviews, these physicians readily brought up themes of wholeness and spirituality. And they noted that it was wholeness that was actually felt by patients in the presence of others. It was not just a wholeness they felt individually and internally. It was a wholeness they felt in relationship to their social lives, to their social relationships, and to their connections and meaning in society. That was wholeness, and that's what they had learned from patients. So it really has something to do with whole person connection. So what has happened to healing in healthcare, and how do we get it back? I realize that when I use the word healing or healer, some of us react to that a little bit because we have this connotation. Maybe it conjures up images of like quack remedies, like the healer. We're going to see the natural healer. And some of us have some bad experiences with that in contrast to what biomedical science can offer. And we feel like this thing coming up like, oh, healers are not legitimate. It's actually, maddening a little bit how quickly some of our patients will embrace whatever they see on the internet that's the next trendy treatment for something that is completely illegitimate and potentially harmful. And we are sitting with patients all the time trying to get them to trust us more than Dr. Google, and trying to engage with the questions and the accusations that they have encountered on the internet, right? This is like a daily chore for us. And I understand that we react a little bit to these words because of that. But is it possible that we've actually set up our patients to seek help in fake cures because we've neglected the whole person aspect of healing? Like they don't feel whole yet. They don't feel healed yet, even when we have been giving them the right biomedical treatment. Healing requires several things. And this is something that this paper pointed out as a theme that physicians have identified. Number one, identifying the source of suffering. Okay, that's what we do biomedically. Diagnosis, is it? So sometimes the source of suffering is not just the physical symptoms of a disease. It's also the emotional impact of a disease. It's also the psychological impact of a disease. It's also the spiritual aspects of a disease. And then, so if we have been taught this, if we miss the diagnosis, it's all gonna fall apart. Like it clinches on this. Whatever treatment plan that we set up around that needs to have a correct diagnosis. So if we're gonna set up a treatment plan to heal people truly, we do need to understand better how they're suffering. And then we also need to help patients find meaning beyond the suffering. And we also need to help patients reestablish their personhood. Because one of the things that frequently we hear from our patients, that they don't feel whole because nobody really saw them. Nobody really heard them. They're talking about their personhood. They're talking about their individual value. They're talking about being recognized as more than just a disease and a number. And this is simple. This is very simple stuff to do. And this is what heals people. I think that it's actually impossible to fully meet this idea of whole person care if we neglect a person's spirituality and their spiritual realm. And unfortunately, in biomedical medicine, we really have left that to the side. It's just as important as their emotional, psychological, and social determinants of health. Jesus taught that suffering has meaning. And this is one of the things that as we encounter him, we receive from him. We receive meaning. He showed us that suffering can be transformed into love and compassion. And this is something that we can actually bring into the room when we're treating patients, actually transforming their suffering with our love and compassion actually heals them. There's plenty of studies that show that when our patients involve themselves in support groups, they actually have really improved outcomes. And this has been validated over the years in many ways and in all specialties. Having social support, expert support really does help patients heal. And it makes sense that that would be true because in that setting, there's some things happening that enhance healing. And I want you to think about this. There's connection. So there's love. There's a sense of you see me and you value me and you hear me, and people get to listen to each other and talk to each other. There's also affirmation of, hey, this could get better. People telling their stories, telling what they've gone through. It raises hope. There's perhaps an expert in the room who gives ideas to people for pathways forward toward more healing. So that's hope. So what do we have so far? We have love. We have hope. Those sound familiar. These are the super forces, right, that we have encountered through Jesus that permeate our world, are absolutely essential to healing. And we have scientific data showing that to be true. So does healing come through medications? Does healing come through surgery? Should we throw that away because it doesn't really bring healing alone? Does healing come through therapy? Does healing come through the therapeutic presence? Does healing come through connection? Does healing come through hope? I would say yes, 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 and yes, yes, yes. All of the above, right? It's why when I do surgery, I love to pray with my patients right before. I'm connecting with them. I'm reminding them and reminding myself that this surgery alone won't heal them. It may cure them, but it might not heal them. I'm acknowledging them as a person. I'm seeing them. I am valuing them. I am asking them what they're worried about right before surgery. I affirm it. That's comfort. Yes, that's normal to feel that way. I connect with them on a trust level. I usually thank my patients right before surgery for being so willing to trust me, for giving up control to me for a few hours to help them. That's a huge honor and privilege that they would do that. I've watched people's anxiety levels come way, way, way down just by thanking them for trusting me. Why? Because I've acknowledged that what they are experiencing emotionally is valid. And it's incredible thing that they're doing to give me that. And then I asked them if I can pray for them, if that would be okay, or if I could give them a blessing. I've never had anyone turn me down, ever. Some people choose a blessing over a prayer. That's fine. I honor that. But most people are really moved that we would acknowledge the spiritual realm in the midst of what they're about to step into, and that I would acknowledge I need that, and that I need the strength and the presence of God to be with me while I'm doing surgery. It really brings comfort. And on the other side of that, we actually may see healing because we've actually ministered to all the aspects of what that patient needs. And it actually does not take more time. Like I start to say this and I hear people, I feel their anxiety of like, oh, another thing I have to do, as if I have any time to do anything else. How do you not have time to do the thing that will heal patients? This is not what we're supposed to be doing. Isn't that what you want to do? Isn't that what brings us fulfillment? You're going to see that patient anyway to sign off on their chart right before surgery, according to JCO requirements here in the US, right? Why not take a few minutes to do the other aspects of healing that our patients need? So can my patient experience healing without a cure? Now that's an interesting question, isn't it? And I believe the answer actually is yes. And we do know this to some degree. We have patients who have long-term medical issues that we don't yet know how to cure. So I think of one of my patients who has interstitial cystitis, which is also known as painful bladder syndrome. And it's a very complex chronic pain disease. And it has probably multiple reasons for why it develops. It's often complex in that it's associated with other pain disorders at the same time. And there's multiple treatments, none of which are perfect, and some of which work better for some people than others, right? This is one of those frustrating disorders that we work with because we don't get the cure very often. And yet, I have one particular patient who has such severity and complexity. I've been working with her for almost 10 years. And over that period of time, she has rediscovered function. She has developed coping. She's restored her mental health instability. And she sees me regularly. I see her every month for a bladder treatment. And she told me about a year ago something really profound in that she felt that she had come to a place where she realized she was healed. And she wasn't talking about some sort of supernatural healing. And she began to list out why that is. Like, I have a way of staying pain-free. I don't have limitations to my daily life anymore. We've developed a strategy for what works best for me. And I really enjoy coming in to see you. You validate my experience. You're always willing to try something more. You never run out of ideas. You're always hopeful. And I hadn't cured her. We hadn't cured her. And sometimes when I think about people like her that I care for, I feel frustrated. And they're the ones that I like pray for. Ugh, give me more ideas. I really want to see this stop lagging behind them the rest of their life. I want to see them fully free of it. Of course, that's our heart for our patients. But she felt healed. She felt that her life had been restored. And so I think it's a really important reminder to us. Healing and curing are not the same thing. And our healthcare system needs this course correct. Healing is what our patients actually want. And it's actually what we need restored to healthcare. And it's small adjustments that will do it. It's us restoring that gap in spiritual care and acknowledging patients' need for personhood and validation, affirmation, and hope. And we're going to see that. I think we can do it. Can we restore healing in healthcare one by one? I think so. I'm Dr. Jennifer Kang, and this is the Restore Healthcare Project. Healthcare professionals, I'm so excited to be able to connect with you on issues regarding spiritual needs in healthcare. We want to partner together to see some of the ruined places of healthcare culture restored by hope. Follow us at restorehealthcareproject.org and like and subscribe to our YouTube channel and social media.